So we have learned a lot about managing patients with CAR T cell therapy. I was referring to measures we can take, prophylactic measures that we can take to reduce the risk of some of the acute toxicities like CRS and ICANS. And we have seen data with itacitinib in this meeting. We have seen previously published data with prophylactic dexamethasone or prophylactic anakinra. But I really think that the more important aspect of management of patients' supportive care really is maybe a bit down the line, and we have seen that there is a significant risk of non-relapse mortality in our CAR T patients because they have persistent B-cell aplasia, hypogammaglobulinemia, and there is an increased risk of infections. So enhanced immune monitoring, monitoring for maybe response to vaccinations, their antibody titers, considering them for immunoglobulin replacement therapy. This will form a very important strategy of managing these patients over the months after CAR T cell therapy to try and reduce the risk of non-relapse mortality that we have seen in this treatment.